Okay, family, the reason why I named the company Check, Call, Care, because that's what the American Red Cross uses in case of emergency. They call it the three C's, okay? So if you're ever in an emergency, you want to know the three C's, which are check, okay? So the check portion comes in two parts. Before we check the person that we see unresponsive or down, we're going to check our surroundings first, okay? Because you want to make sure that you don't wind up like the person you're trying to help. So make sure the surroundings are safe so that you can come in and help. Of course, if they're on the side of the road, you want to check for cars and make sure that it's safe. If the person is in a pool of water and they slipped, you want to make sure you don't slip and have a concussion as well. The person may be experiencing some type of toxicity in the air. Okay, so you want to make sure before you go in that it's safe for you to go in because we don't want two people down. Okay, once we know that the situation or the environment is safe, now we're going to go in. And the first thing we do is going to tap the shoulder of the person who's unresponsive. And we give it a good tap on the shoulder. And then we're going to say, hey, are you okay? Can I help you? Is everything okay? You want to say in a not too loud, but a forceful voice because they may be taking a nap and you just ruined their day, okay? So just make sure that they're okay, tapping the shoulder and asking them, hey, is everything okay? Can I help you? Are you okay? If they are unresponsive, then we are gonna get a little bit closer, okay? And we're gonna take our ear and put it right by their mouth. And the reason why we do that is because we're gonna feel for breathing and listening for breath. So we've got to make sure that they're breathing. And I'm going to tilt my head looking at their chest to see if it rises or falls. Okay? So we tapped, we shouted. Now my ear close to their mouth, listening for breathing, feeling for breath, and looking at their chest to see if it's rising or falling. Okay? That's the check portion of the check, call, care. They are not breathing. They are unresponsive. Now we go into action where we call. So if we are alone, we are going to make that 911 call. If there's a person around to assist us, we are going to tell them, hey, call 911 and look for a first aid kit and AED machine, okay? And come on back, okay? Remember, when you do call 911 or you send someone to call 911, the operator is not going to want to know the emergency right off bat. So don't go in, oh, they broke their leg, I could see their bones sticking out. They're not going to want to know any of that. The first questions they're going to ask you is, where's your location? Okay? What's the specific location? If you're at a school, where we're at the school, I'm in the cafeteria. Can you meet us somewhere to guide the emergency responders to the location? Okay? They're going to ask your name, your phone number, in case you get disconnected. Okay? They're going to ask what type of emergency it is. What type of help do you need? Are there people there to help you? Okay? So you have to be calm in that situation. They'll get to the emergency, but they need this vital information before they can move forward. Okay? So remember that if you're calling or you send someone to call, make sure that they must maintain level-headed and calm to give the proper information so that the people can arrive on time and help you. Okay? So after we call, now we're going into check, call, care. And we're going to give care to the best of our ability. We're going to make sure the person is comfortable, if we can help it. If they are not breathing like this person is, we are going to start our CPR. Okay? So what we immediately do, we are going to put our knees right by the person, interlock our fingers and hands. Make sure these hands are up because you don't want them digging in their chest. Then over the person, we're gonna lock our elbows. Not like this, lock your elbows. And then you're gonna use your weight to press down. We press it down about 2 inches, the compressions, okay? And we coming up, 30 compressions. After we do the 30 compressions, we are going to give them 2 breaths. So it's 30 in 2 cycles, okay? And then for the breaths, we are going to lift the chin, pinch the nose, seal the mouth, and breathe for about 1 second, making sure the chest rises and then falls, and then we give them the second breath, rise and falls. If one of the breaths does not go in, we only get 2 chances. Don't stay here trying to get the breath in. We're going straight to compressions again, and we complete complete the cycle. 30 compressions, 2 breaths. 30 compressions, 2 breaths until help arrives. Okay? That's it. Check, call, care.